If I had to do anatomy all over again, there are a few key things I must take note of. And in this video, I'm going to tell you in retrospect how a medical student should, approach the study of anatomy. Now, this is mostly going to apply to younger medical students in the house. And if you have to do anatomy over again anyway, if you want to do anatomy and if you want to have a basics that is going to translate into effective clinical knowledge and care, then this is how I think you should go about it. Hello guys, and welcome to my channel. My name is Dr. Peter, and in this video, we're going to be discussing how to study anatomy. First off, let me just off the bat, anatomy is the most bulky of your preclinical learning. Now, as you know, the study in medical school, we broadly divide medical school into two: the second year or the first 3 years and the last 3 years. This varies from school to school, but essentially that is the structure of medical school. The first 2 years in medical school, essentially, and I'm not counting the foundational year or the 100 level as the case may be, but the second year and the third year in most schools is dedicated to preclinical learning. What this means is you likely not see any patients in your first 2 years of medical school, like when you're in medical school proper. You'll be learning pre-clinicals, you'll be learning with specimens, you'll be learning in the lab, you'll be learning anatomy, physiology, biochemistry, integrated medicine and all that. So in your study, the most bulky of all of those three, physiology, biochemistry and anatomy and integrated medicine or integrated paper as they used to call it, in those four, anatomy is the most bulky. I want you to realize this significantly. Anatomy is the most bulky. For most of the other subjects, for most of the other courses, one textbook is enough to study physiology, for example. One good textbook is enough to study biochemistry. But for anatomy, you need a combination of many textbooks, which will all not be enough. So you need an aggregate of learning from multiple textbooks for you to be able to have an understanding that is enough for you to pass your exams and have an understanding and good knowledge of anatomy that will take you into clinical years and clinical learning. So anatomy is the most bulky. I want you to have that very clearly and very boldly at the back of your mind. This means that you have to approach the study of anatomy probably a little bit differently than you are going to approach the other subjects. What I'm saying is that you need to have a pre-knowledge of how you're going to approach the study of anatomy so that you can pass your exams, and I think maybe more importantly, so that you can have an understanding that will translate into your clinical years and on your practice going forward. If you are new on this channel, I discuss this kind of things on this channel for young doctors, medical students, clinical students generally. Please do subscribe to this channel, like this video as it helps the algorithm generally. The first thing I'm going to say is choose the books you want to use and then stick with them, and choose early. There's no need spending the first year of your study of anatomy deciding which textbook is ideal, which one is better, which one has better diagrams and all that. All that pales when it comes to the bulk of the knowledge you have to learn. So decide early what book you want to use. Now the question medical students will always ask is, what book is best? What book is best? I'm going to give you this epitaph for you to have. The best book is the book you are going to read. Now, there's no point having all the colored textbook and all the highlighted textbook and you don't read them. So it doesn't matter so much of what book you are using, but which one are you going to study? Now, the first way to know which book you are going to learn is, what is the school recommendation? Many schools have different recommendation based on the faculty, based on your professors and your teachers. What do they recommend that you use? And the second place you can get a very good tip of how to select your book is your seniors. What do they recommend? What do they say is the most helpful in learning and also in exams? Now, for the old schools, for the first generation schools, most times your faculty will recommend that you use the older editions and the older books in learning anatomy, such as Last Anatomy, which is like the most famous anatomy textbook world over. Other schools will recommend that you use Cunningham's. Cunningham's is more pathological and clinically inclined, and it has a lot of knowledge. But the second generation of teachers will recommend that you use more colorful texts like his more clinical oriented anatomy and books like that. But as I said earlier, the most important thing is what book are you going to read, because in the long run you are going to learn anatomy irrespective of the book you use. And then secondly, what is the recommendation of the school? So choose accordingly. And I think the last point to consider when choosing the book is, what book are you comfortable with? So if you prefer the colorful illustrations in clinical anatomy or clinical oriented anatomy, then there's no point going to the monochromatic rendition of Cunningham's anatomy manual and all that. So choose according to this the aforementioned preferences or criteria. The divisions of anatomy properly. If you are learning anatomy, as for example a second year medical student, you have to learn embryology, you have to learn histology, you have to learn gross anatomy, and then to cap it all off, you need to learn genetics. These are the four cornerstones of learning anatomy. Now, this is if you are in the medical curriculum. Of course, anatomy is way broader than that. There's a lot of things embedded in that, and even that, as it seems just four cornerstones, there's a lot to learn even in that. Now, if you want to study generally, it's best, for example, initially you're going to do the general introduction to anatomy, where you'll be learning about the cell, tissue, and all that. Those are the foundational years. Eventually, you start learning systemic anatomy, where you'll be learning, for example, the respiratory system. Now, when the time comes for you to start learning systemic anatomy, do not forget to always start with embryology. Why? It is best to see how it is formed. When you know how a system or an organ is formed, you can understand why it functions the way it functions, and you can understand the fully formed, the primordium and then the organ itself. If you understand how the primordium is formed, you can now know why the structure is the way it is in the adult form or in the fully formed organ. And not just that, if you start with anatomy, you would also understand better how the system functions by the time you start studying physiology. As you know, it's an integrated curriculum in the long run, and you're not learning all these things in isolation. You're supposed to put it together, and I'm telling you, the best way to start is to start with embryology, how it is formed. Of course, there are many books for anatomy, for embryology, but whenever you are studying embryology, it is important to remember that the two-dimensional rendition of your textbooks will not cut it. The description your teachers are going to give in class, if they are just lecturers, it might not truly cut it. The best way for you to understand how this tissues, how this system is formed, is to probably look at three-dimensional renditions of animations, possibly online, such that you see how, for example, the derivation of the three germ layers, how it forms, how the embryo forms from one cell to two cells to a blastocyst, all the way to a flat laminal disc that becomes three layers, and how it folds. If you look at a three-dimensional rendition of this, there is no way your comprehension will be different. Now, there's a slight difference between what it means to comprehend and how to have the fact. It's best to have a comprehension and have the fact so that you can understand and pass your exams. However, I strongly suggest that you look at three-dimensional renditions, especially when you study embryology. Say a little note here on histology. Many medical students ignores the study of histology. When it comes to looking into the light microscope, a lot of people get discouraged because they just see blue and pink, and they are not really able to differentiate and to make so much meaning out of it. And I was like that in my first year. In my second year medical school, I was like that. I was always agitated and anxious when it comes to histology, because I look into the microscope, I don't really understand what I'm doing. The instructors seem 2 paces ahead of me. By the time I'm getting the concept, they're already 2 concepts away. So it was difficult for me to really get it. So this is what I suggest for you to, this is how I suggest that you're going to go around it. Now you have electronic learning tools. When you're going into the lab to look at tissues that are stained, slides, when you're going to look at slides, it is best that you look at, for example, the slide of a pancreas. Look at what it is online. Look at what the ideal is online. The best renditions from the best lab will upload their slides. Look at what it is on Medscape, and then look at what it is in the light microscope in front of you. Now, you might not be able to do this completely in the time allotted. However, from personal experience, I can tell you this: if you decide to voluntarily go to the anatomy lab or museum in your spare time, ask the instructors to give you a light microscope, set it up for you, and then take your time and really get the configurations of how to do the fine adjustment and the coarse adjustment of your light microscope. If you really get familiar with the light microscope, you become more comfortable, setting up the slide, looking at it, and even making meaning out of those slides. Now, this is so important, because if you do not do it in your second year and especially your third year, it's going to come back to haunt you in your fourth year when you start learning pathology. By the time you start looking at histopathology, because if you don't know the normal, how can you know the abnormal? And then you don't have to wait for 2 years before you start learning the basics of light microscopy in your fourth year. Like, it makes no sense. You are just, taking yourself all the way back. So make a decision to voluntarily go to the anatomy museum maybe 2 or 3 times. Get very familiar with the light microscope. Now, I can tell you, before trying that, you are likely going to break some slides if you really truly commit to learning. Now, you say, why would I suggest that you break slides? No, I'm not suggesting that you break slides, but I'm saying if you really dedicate and want to pay attention to the slides and try to adjust them and know, it's likely that you're going to break 1 or 2 slides. But that is a small price to pay for the learning that you're going to have. For all we know, you could be the next Broadman who's going to describe the histopathology of parts of the brain that we have yet to know. So it's important that our training in medicine is peculiar because you are trained to be a scientist and you're also trained to be an artist. You're going to practice, so you are going to be performing the art of medicine, but also you are trained so that you can also win the Nobel Prize, the next Nobel Prize. So it's important that you dedicate yourself to the study of histology. But that's so much for histology. Again, let me just do a recap. Get the ideal tissues online, the slides online, and then look at and compare with what you have in your light microscopy. Get familiar with the light microscope, the adjustments, the stage, the windows, and all that. Get very familiar with it. Clean the lenses if you have to, because some of the light microscope in the museum might not have been so used because students don't really engage in them. Get very familiar with them and then make the best of what you can when you still have to learn normal tissues. Now, moving on to gross anatomy, and gross anatomy is the largest bulk, right, of your learning in anatomy. As I said earlier, by the time you've decided what book you want to use, last anatomy, Kismo, whatever it is, and whenever you study gross anatomy, 3 rules. Number 1, your atlas must be by your elbow. Whatever atlas of human anatomy you are using, Fragnetas is very popular all around the world. If you are using Fragnetas atlas of anatomy, or if you are using 3D models of atlases now, like which are available online, or all the apps that are available, if you're whatever you're using, have an atlas by your elbow whenever you study anatomy. There's no point looking for the phrenic nerve or just knowing that the phrenic nerve originates from nerve root C3 to C5. Now, when you see it in gold in Fragnetas anatomy coming out of the spinal root of C3 to C5, it registers better in your mind. Now, I said the first rule is have an atlas by your elbow. The second rule is use models. Now, anatomy faculties around the world have anatomy faculties around the world, in a bid to make the study of anatomy more interesting and less theoretical, have decided to start giving students models. They started giving students bones or models of bones, 3D models of bones to take home and to take when they study. Now, if you need models when you study, especially when you start studying the complex anatomy of the skull, all the foramens in the skull, all the subtleties in the anatomy of the bones, all the tuberosities and the grooves and the canals. If you have the humerus in front of you and you study it, and you study the muscle attachment, and you see the roughness where the sartorius does not innervate on the humerus anyway, but when you see the pes and when you see where the muscles originate from and when they insert to, it registers in your head significantly better, makes you a better student, makes you a better candidate for the exam, and eventually makes you a better clinician. Now, this is going to be very important for those of you who already know somewhere in your heart that you're going to be surgeons. This is the time to invest in the foundations, and anatomy is like the foundation like no other. So have an atlas, have models, and then this is like a special tip. You need a human atlas. Now, I'm not saying you should go and do the barbaric act of actually killing people to check out their organs. No, that's not what I'm saying. You don't have to be like Da Vinci and the other foundational fathers of anatomy who had to exhume corpses to actually. I'm saying the video atlas of anatomy online that you can actually check, such that you can see fresh tissue dissections. Now, fresh tissue dissections are special because you see. It's the closest you get to seeing what happens in the theaters, by the time you start doing actual surgery. So fresh tissue dissections, you can get them from human atlases, video atlases. The best human atlas of anatomy that I ever got to use was Robert Ackland's Atlas of Human Anatomy. It's a series of 7 videos that discuss regional anatomy, and it is beautiful. Robert Ackland is a professor of surgery and anatomy, plastic surgery and anatomy. So the dissections. The next subset of anatomy we're going to talk about is genetics. Now, genetics is broad. However, what you need for the syllabus, what you need is the foundation of genetics, and you can actually get this from maybe your class materials or textbooks as you like. But it is compared to the other parts of anatomy, is actually a small chunk of what you need to know. So once again, embryology, start with embryology. Histology, pay attention to your light microscopy and anatomy museums. Gross anatomy, choose early, use video atlases, and it's the bulkiest. Then genetics, use whatever means of learning is available to you, and then just pay attention. Now, genetics is peculiar because it is going to record throughout your practice. It's going to come back to meet you in histopathology. It's going to come back to meet you in pediatrics. It's going to come back to meet you further on when you start practicing, because you're going to be doing a lot of genetic counseling even later on in life, irrespective of where you decide to practice around the world. So you have to actually pay attention to learn genetics foundationally, have it once and for all. Know that every other exam coming towards you in the line of genetics will be quite easily. Now, let's talk about something that is very uncomfortable for a lot of students: dissections, practical dissections. How do you go about practical dissections? Mainly, a student decided to end their medical career before they go to medical school because they knew they were going to be exposed to cadavers, that they were going to be exposed to corpses that they have to dissect. Now, a wise man once said, what is unavoidable is better welcomed. Formalin is the preservative they're going to use to store corpses, cadavers. It is toxic. It's going to sting your nostrils and your pharynx, and it's going to make you dizzy. It's going to make you feel lightheaded and noxious. It might even make you pass out outright. But what is unavoidable is better welcome. Now, by the time you go to the labs, to the anatomy museum, frequently enough, all the initial sensation of the toxicity of formalin is going to pass gradually. And then you can now invest and commit yourself to the learning of anatomy and do your dissections. They are cadavers. They are now non-living things. There is no point to be sentimental about it. You are not the first 10,000 person who is going to be doing dissections. Butchers do dissections on animals. Unskilled people know how to do dissections. Now talk less of you who aspires to be a surgeon or who aspires to be a doctor. Be bold about it, follow the instructors, and actually achieve something. It is best most times when you go to the museum, you're going to be split into groups, micro groups, so that your learning will be more experiential. I put it to you who's watching my channel, who's watching my videos, to lead your group. Be the bold one. Take the scalpel and put it on the clavicle of that cadaver and start the dissection, and then discover the way how you go. Like, you already make mistakes, so you can as well just make more mistakes and then discover along the path of your learning. Of course, by all means, follow the guidelines in your dissection manuals so that you can actually see the structures and appreciate them as it goes. I say this out of experience, and even a little bit proudly so, because I followed my dissections even all the way through the original dissections, even all the way when we started learning neuroanatomy. And it was nice to actually see things practically that you see in your textbook. It makes the knowledge and the learning sticks in your head in 3 dimensions. Embrace dissections and do away with it. Since you're going to be a doctor in the long run, and it is important that you know this. The study of anatomy, as I said earlier, is very broad. However, there is clinical anatomy. Clinical anatomy is what you are going to be using every other day in the hospitals when you start practicing. For example, if you're studying the regional anatomy of the abdomen, by the time you're learning the abdominal wall, your anatomy lecturers might be so interested in teaching you the 10 layers of the abdominal wall. But your clinical anatomy lecturers will be interested in telling you type of abdominal incision, Kochas incisions, Lance incisions, median phalansteal, paramedian incisions. Now, those are the things that you're going to take away clinically from that class. Eponyms are something else you're going to be taking away from anatomy class, from clinical anatomy class. So by the time I say Pupat's ligament, it's the same as the inguinal ligament. Now, it has been standardized, right? We use anatomical terminological now. We use the standard anatomical terms. But the old clinicians still hold on to the eponym. So they will still say McBoney's point. They will still say Pupat's ligament. They are still going to say artery of Rolando. We're going to be calling some eponyms. And the famous eponyms are the ones you're going to take along with you when you are leaving anatomy. Clinical anatomy is something you should pay attention to. By the time you are done discussing, for example, the knee joint, by the time you have studied the knee joint, you know all the 10 arteries that participate in the anastomosis around the knee. what you're going to take away clinically is the rupture of the media or of the anterior and posterior cruciate ligament. What you're going to take away is the injury to the lateral and medial meniscus of the knee joint, because that is what is going to translate to knee injuries later on that you're going to be seeing as a doctor. So you should remember to have a subset called clinical anatomy that you're going to take away to surgery when the time comes. The last thing I'm going to discuss here in terms of studying anatomy over again is how to go about anatomy exams. Now, exams are, a driver to learning. Unfortunately, we can't do without them, and that is the best way possible. We know how to test and assess the knowledge of students for now. So at this point, you actually have to learn how to write exams. I've done a lot of videos on how to take exams, and you can check them out in my channel. However, we're going to talk about how to do anatomy exams here. In your second year of medical school, by the time you're learning the foundation of anatomy, when you're talking about the cell, tissues, and all that, the structure of exams, of how to approach questions in the exam, will still be a little bit rusty because you are going to be learning basic concepts. However, by the time you start learning systemic anatomy, by the time you start learning gross anatomy, you have to follow some basic outlines when you are presenting your answers in the exam. This is so super important. For example, you are going to have to discuss, for example, the anatomy of the shoulder joint in one of your exams. It's very, very likely, so important, it's so common. The injury to the shoulder joint is the most common, one of the most common orthopedic injuries that there is. So you're going to have to discuss anatomical concepts such as the shoulder joint. Now, if you are doing these discussions, there's a formula to follow in anatomy, and that is that by the time you have done your introduction, and by the time you're going to end with a conclusion. Your conclusion is likely going to be what? Exactly, clinical anatomy of the region you are discussing. So those two things must be in your discussions whenever you are answering questions in anatomy. Your introduction, which is going to be a foreword of what you're going to answer in question, and then your conclusion, which is likely going to contain clinical correlates such as anterior posterior dislocations, fracture dislocation of the shoulder, and all that. But in the meat of the matter, when we're talking about gross anatomy, you must remember the muscles around that region you're talking about, the blood supply to that region, the innervation to that region, the drainage, the venous drainage, the lymphatic supply. These are like things that you can't do without when you're talking about structures of regional anatomy. For example, if I say you should discuss the anatomy of the bladder, by the time you have told me it's a hollow organ located in the pelvis that is responsible for the temporal storage of urine, the next thing you have to be telling me is, relations, anatomical relations, then the structure of the muscles, then the layers. Then you start telling me the blood supply, the venous drainage, innervations, and then lymphatic drainage. And then, of course, you end with clinical anatomies, such as bladder rupture, such as cancer of the bladder, and all that. However, don't forget to put the most concrete part in the outlines there. Another part of anatomy exam that you can't do without is anatomy practical exams. And there are two parts of the practicals. There's the practical exams, you're going to be like identifying bones and all that, which is why it's super important to learn with the models in the first place. You're going to have models of bones, of tissues that you're going to take home, and then you're going to be looking at those actual organs in the anatomy museum when you go for your practicals. That's why I say you should pay super attention to them. And then the bones especially because in most practical exams and in most vival exams, that is the oral exam, you're going to likely pick a bone, pick the rib, and discuss the anatomy of the rib, because anatomy practicals teachers like to be practical in their vival exams. Here are some tips to vivals. Be very polite. Pick what you are confident in if you have an array to pick from. Because we see all these memes of medical students who take things and then who can't identify them. You don't want to. You never want to be like that. The way not to be like that is to practice with the models in the first place. Practice with the models. Take them home and practice with them in the first place. Now, in your vival exams, like the questions you don't know, there's no need to gamble about them and embarrass yourself and your lecturer or your teacher. You can admit that, sir, I cannot remember this particular question. I would like to attempt another question if that is possible, in the most polite terms. And if you want to do the ultimate hack, since it's a vival exam and you have a time allotted, you can as well at the end of the exam say, sir, please, can you remind me? Or sir, please, I'd really like to, by the time, if you don't know an answer, for example, and you don't know what particular bone is this, and you have forgotten that it's actually the patella, By the time you're done with the exam, it's okay to say, sir, please, what bone specimen is actually this? I don't want to leave this exam without having any idea of what it is. Now, it makes the exam more practical. It makes it less of a confrontation and actually a desire to learn, which is what your lecturers want in the long run. If the lecturers could check in your mind and know that you have a spirit to learn and an eagerness to learn, there might not be exams. But since there is no way to find out that, we still have to resort to exams and objectives and essays and all that. But anyway, that's so much as I'm going to take in this video today. If you enjoyed it, don't forget to like this video, subscribe, share with your friends who are studying anatomy so that we can all be better students, better doctors, and better clinicians. Thank you very much for watching, and see you in the next video.